Welcome, Lenore and Rob.
Are we on?
Yes, you are.
Oh, great. Welcome. My name is Robert Rooks, Chief Executive of Alliance for Safety and Justice, and it's an honor to open today's official launch of the National Coalition of Shared Safety. The National Coalition of Shared Safety is a national coalition working to change how governments pursue and protect public safety. We are bringing together the solutions that communities need to attain safety. This is the first of its kind group, representing all kinds of safety solutions, working toward a common goal. We have public health organizations like Doctors of America and the American Public Health Association, organizations serving crime victims like the National Association of Trauma Recovery Centers, the National Center for Victims of Crime, and Futures Without Violence. Reentry service providers such as Safe Housing Network, a New Way of Life Reentry Project, the Responsible Business Initiative for Justice, Dave's Killer Bread Foundation, and Center for Economic Opportunity. And violence prevention organizations working at the community level to stop the cycles of violence, including the Urban Peace Institute, the Health Alliance for Violence Intervention Programs, Cure Violence Global, and Professional Community Interventionist Training Institute. Recently, states across the country have been grappling with the need for changes in our justice system. There's been an increasing recognition across the country that too much incarceration without enough prevention and treatment locks states into a costly and ineffective prison system without support from communities hit hard by crime and violence. In the last 4 months, the urgency related to making those changes have become paramount, and we're now facing unavoidable realities. Our justice system first is spreading poor health. Also, our justice system continues to be ripe with disparities. So in this context of unprecedented urgency around the need for change in our safety and justice systems, we're launching this coalition to focus on solutions. We're talking about solutions that have been working at the community level, often operating on a dime, that if we scale them to meet the need, we can bring an entirely new approach to public safety, an approach rooted in public health and crime prevention and supporting the most harmed but least helped, and rooted in stopping the cycles of violence in partnership with communities. The Coalition for Shared Safety formed to build a policy agenda focused on achieving safety for all. The old approach of criminal justice and safety was more about safety for some and the bureaucracies that came with it, which was costly, ineffective, and unfair. This new approach is possible. We know it works. We're joining together to create a pathway forward.
Good afternoon, Lenore Anderson here, co-founder of Alliance for Safety and Justice with Robert Rooks. It's an honor to connect with everyone today and to launch this very important new coalition focused on solutions. The National Coalition for Shared Safety is coming together to put forward what Robert was talking about, those tangible solutions. Our nation has never been more clear on the problems. And so now we're turning our attention to answering the question of what we need to do instead. We've brought together leading organizations who are grounded in the following principles. First is the principle of public health. It couldn't be more important than ever before to recognize that the most effective pathway to public safety is a pathway through public health. When we focus on public health at the community level, we have safer communities. The second principle is well-being. Well-being is a key metric for public safety. How stable and supported are our vulnerable community members? That helps us identify our public safety needs when we look at well-being more than just looking at arrest and incarceration data. The third principle is survivors at the center. Listening to survivors of crime and violence, we can clearly see what we need to improve safety and help survivors recover. The fourth principle is mutual responsibility. Community and diverse public agencies must work together. No one system can solve the cycle of crime by itself. We have to pull public health leaders together with community leaders and those in criminal justice to really transform how we approach safety. So those are the principles that are driving the new Coalition for Shared Safety. And I will now tell you just a little bit about some of the legislative and budgetary priorities that we're working together to promote. Really, what we're talking about here is scaling up. We're talking about scaling up the solutions at the community level that have not been invested in to scale, not invested in at the level that communities need to really have those solutions become the centerpiece for our criminal justice and public safety systems. The first is scaling up violence prevention. We know what works. It's often underfunded and undersupported. The second is scaling up trauma recovery and victim services. Most victims of crime do not receive help in the aftermath and do not receive that help from the justice system. We've got to build the community link there to get the kind of help survivors need. The third is scaling up reentry and workforce development. We know when we invest in meaningful redemption, meaningful pathways to rehabilitation for people who have served their time, we improve safety and improve community stability. The next is scaling up public health solutions to mental and behavioral health crises. We know what works. It's often undersupported and happening on the side as opposed to at the center. And then last thing that we're focused on in terms of legislative and budgetary priorities relate to allocating to what works. Money from the justice system, especially money that has been growing and growing on the prison expenditure side, is money that can and should go towards stopping cycles of crime and violence at the community level. The less that we waste on excessive back-end imprisonment, the more that we can have smart approaches to safety locally. So we're excited to be introducing our coalition to you today, and we'll kick off our conversation with comments from key members of the coalition. And because we want to hear from you, we'll also be leaving time at the end for questions. Thank you.
So today I will introduce to you a stellar group of panelists who've been working together to build this coalition over the last several months. First, we'll have Fernando Rejón, Executive Director of Urban Peace Institute, Susan Burton, A New Way of Life Reentry Project, Oswald Thomas from Crime Survivors for Safety and Justice, Dr. Georges Benjamin, Executive Director of American Public Health Association, and Genevieve Martin, Executive Director of Dave's Killer Bread Foundation. First, let me start with you, Fernando. Urban Peace Institute has been involved in street and neighborhood violence prevention for decades now. We know that there is currently a discussion about violence in communities, and yet there's a significant gap in bringing the scale of resources to address that violence. So please tell us about the important work of your organization and how you're seeking to achieve shared safety and the role Urban Peace Institute plays in a comprehensive safety strategy.
Thank you for that, Robert. It's a pleasure to be here. Pleasure to be able to share with everyone a little bit about our work. The Urban Peace Institute is a social justice organization that implements violence reduction strategies and smart justice solutions to end mass incarceration and ensure communities have the ability to thrive. Our work over the last couple of decades, we've seen nationally, demonstrated declines in community violence and improved public safety, resulting from sustained investment in violence prevention strategies that are comprehensive. So many of these strategies embrace former gang members and formerly incarcerated individuals who have transformed their lives to engage active gang members to provide alternatives to violence and de-escalate tensions between groups that are in conflict. So these peacemakers are known nationally as gang intervention and street outreach workers, and they're in cities across the country doing tremendous work on the front lines. In Los Angeles, due to sustained investment in non-traditional public safety strategies, a recent evaluation noted a 43% decline over a 2-year period in violence. However, over a 10-year period, we've experienced a significant reduction in violence as a result of coordinated gang intervention and prevention services. And a lot of this is non-traditional responses to violence. So in Los Angeles and cities across the country, we are reshaping how public safety can be re-envisioned while ending our overdependence on incarceration, overbroad policing, and the criminal justice system, which is at the heart of the national conversation currently. So cities have invested in comprehensive violence prevention strategies, have seen safety improve through targeted investment in building the community's ability to meaningfully participate in citywide efforts to create safe communities. So broadening the frame of public safety will improve the quality of life for all. So when pairing violence prevention efforts with criminal justice reform, utilizing not a lens of criminalization, but a public health lens that seeks to treat and prevent violence will help the nation transform the meaning of safety. The comprehensive nature of violence prevention strategies improves shared safety by expanding the responsibility to non-traditional groups, such as community-based organizations, neighborhood peacemakers, and other key service providers who can serve as first responders in community crisis. Scaling investment in these services will build the necessary infrastructure that not only saves lives, but also saves municipalities millions of dollars a year from unnecessary legal and criminal justice responses that have been shown to be ineffective. Thank you.
Thank you, Fernando. Susan Burton. Susan, you are the founder of A New Way of Life. Based on your lived experience, A New Way of Life offers reentry housing and programming for women returning home from prison. Can you please describe what reentry housing is, the function of it, what you do at A New Way of Life, and how it intersects with this idea of shared safety?
Oh, yeah. Thank you, Robert. I want to say I'm really, really proud to be a member of the Coalition for Shared Safety. It's time. It's past time, and I'm just glad to be here. So A New Way of Life Reentry Project was founded based on my own experience of recidivating in and out in prison over a period of 20 years. And what I know is the majority of individuals released from incarceration are being released with nowhere to go, no ID, no money, and usually end up back in the same situations that led them to incarceration. Reentry housing is a safe, drug and alcohol-free environment for individuals coming home. There is intensive wraparound services and supports to get them back into training, into school, into family reunification, and creating supports to have them be a safe, contributing member of the community. A New Way of Life has been doing this work for over 20 years and have helped thousands of women come back from prisons and jails in California. We've created a model that works, and that model is being replicated all over the nation. Now we're in 15 states, and Robert, I need to say to you and to the audience is that, we recognize the need to provide supports for people coming home. You're sent away and then you're shipped back. Here in California, you're shipped back with $200 to make a new life with. That's the same $200 that was allocated in 1952. The amount has not changed. And we've proven that reentry supports can support our community our community members who are coming back. It can provide safety for our community and support people to build a life beyond incarceration, a life of good civic engagement, a life of strong parenting, a life of a good employee, and so forth. So we're in 15 states now, and I made a meager, humble attempt. But at this point, we need our legislature to understand the value of what we're doing. We provide these services for less than a third of the cost of incarceration. And at the end of a year or a period of time, that person is a contributing, tax-paying, law-abiding citizen. So I hope that those that are listening, the members, their staff, understands the depth of what we're talking about when we're talking about a vision of shared safety. So if there are questions later, Robert, please give me those questions. But we've created a network of safe housing nationally, and that network should be invested in because it's working.
Absolutely, Susan, cannot agree more. Next question, Oswald Thomas. Your personal story is a strong argument for putting crime survivors at the center of safety conversations. As Managing Director of Crime Survivor Safety and Justice, you work with victims across the country. Can you please tell us about a little bit about yourself, your background, about CSSJ, and why crime survivors are a critical component to this shared safety coalition?
Thank you, Robert. My name is Oswald Thomas. I am the Managing Director of Crime Survivors for Safety and Justice, a national network of 42,000 crime victims from across the country. I am a victim of gun violence. After becoming the first male in my family to graduate from college, and I was just days away from heading overseas to play professional basketball when I got shot twice in my back. Those bullets ended my basketball career, and my life was changed forever. And, like many victims of violence, including my father, my brother, my cousin, I didn't receive any services that I needed to recover and heal. Despite contact with law enforcement, I was never directed to any victim services in my community. And I recall during my last doctor's appointment, I learned that the young man who shot me had also become a victim of gun violence 4 years prior, causing him to lose sight in his eye when he was just 14 years old. Like me, he didn't receive any services. And it made me realize that, his unaddressed trauma contributed to my own victimization. And like myself and like many survivors from across the country, we never received the care and the support that we need. And as a result, we fall into that cycle of trauma and violence. The pain and anger caused by untreated trauma continues the cycle of violence that rips apart communities across the country. Over the years, through my work with crime victims, I hear over and over again from a diverse network of victims that the number one priority for victims is making sure, what happened to them never happens to anyone else. Our current criminal justice system fails to interrupt the cycles of crime and violence and does not meet the needs of victims who need healing and support. For decades, tough on crime policies have destroyed entire communities, especially communities of color. These policies do not reflect the views of victims. In fact, in 2016, a poll by the Alliance for Safety and Justice found that nearly 2 out of 3 crime victims wanted shorter prison sentences, not longer ones. They also wanted more investments in prevention and rehabilitation. Crime victims know that to keep our communities safe, we need real safety solutions. And first, we must invest in trauma recovery centers. Trauma Recovery Center is a transformational, new, comprehensive model of care that reaches underserved crime victims like myself and victims of color in those communities most harmed by violence. And second, we must increase access to victims' compensation and victim services. Every day through our Survivors Network, many victims do not know about the Victims Compensation Program, and many victims have barriers to accessing those services. So we need to remove those barriers and increase access to support for survivors. And third, crime victims need to be at the table in policy and program planning, so we can develop policies centered on prevention and healing. You know, not just at the table, survivors need to be leading discussions about what is needed. You know, for too long, you know, communities most harmed by crime and violence have been the least helped by the justice system. And what America needs now more than ever is safety for all, not just for some. And, you know, that's the goal of this Coalition for Shared Safety. And that's why Crime Survivors for Safety and Justice, a national network of victims, is a determined member of this coalition to bring us shared safety. Thank you, Robert.
Thank you, Aswad. Next, Dr. Georges Benjamin. So we are in a historic moment, and public health is at the center of many of the conversations. Can you please tell us about the work at APHA and why it's critical for public health to be centered in discussions about shared safety?
Thank you, Robert. And just let me just talk about how important it is for us to be part of this national coalition for shared safety. You know that 80% of what makes you healthy occurs outside the doctor's office. And I often say that's a very painful revelation for me, who's an ER doc. And, you know, safe communities are very, very important as part of what we call the social determinants of health. The social determinants of health are those societal things that enable you or inhibit you from getting health. Bad housing, access to nutrition, not living in a safe community. All those things prevent you from not having good health. And our criminal justice system in many ways has become a de facto place for people where the health system has failed. You know, too many people with mental illness, too many people with substance misuse disorders are a real challenge, and they end up in our criminal justice system. People for which the health system has failed, who've had early childhood trauma, or who've had lead exposure, or PTSD, or simply where the prevention services done by the criminal justice system simply have not worked out. We also don't provide the adequate care as we should in the criminal justice system. It often results in gaps in care when you leave from the community into prison or jail, and then when you come back. So we need to fix that as well. And then finally, the of transition care, the care that people need doesn't simply, as I said, stop when you go into the to prison or jail, but when you come out. And so we need to really come up with effective solutions. And there's some opportunities, there's some legislative solutions like the Reentry Act that the House just recently passed and that the Senate is considering, which would actually absolutely engage people in adequate health care as they begin to transition from jail or prison into the community. Is very, very important for us to do. We have to make sure that we have a seamless transition of care for people who are in the community, opportunities for them not to have to go into prison or jail through preventive efforts. But should they end up there, adequate care, and then a smooth transition with adequate care as they reenter the community. That is cost efficient and effective. Thank you, Robert.
Thank you, Dr. Benjamin. Could not agree more. Last question of the first round, let me say. We have more time together for sure. Genevieve Martin, we hear a lot about second chances and barriers to employment as one of the largest obstacles for people fully integrating back into community after incarceration. Dave's Killer Bread Foundation is a leader in the business community to advance employment for people with criminal records. Please tell us more about that work and how it fits into a shared safety conversation.
I'm excited to be here and talk about arguably one of the most simple things that communities can do to make shared safety actually possible.
Right.
So we focus, and our knowledge base is really around second chance employment, and that is hiring the best person for the job, regardless of their criminal background. We were born out of Dave's Killer Bread, which is the #1 selling sliced organic bread across the country, where nearly 40% of our workforce have felony convictions in their past. We learned early on and really quickly that most of our star performers had this shared experience of having a conviction history and or having experienced incarceration. What we saw in our talented teammates were that they were some of the most loyal, resourceful, diligent, dependable people on our teams, which is exactly what you want to recruit more of. Over the years, as we created the foundation and began to network and better understand the space, we realized that other companies had had the exact same experiences. And that includes organizations like Johns Hopkins, Mod Pizza, Nehemiah Manufacturing, Slack, Uber, and many more. And what's exciting about this particular space is that it doesn't require a lot. It requires individuals within companies to think about people in new ways. Our largest barrier in this space is debunking stigmas and myths. Yeah. And so when we're able to expose business leaders and human resource professionals to people with lived experience that have been directly impacted by the legal system, by the barriers that have been set in front of them, and we're able to demonstrate the resilience and the transformation in individuals who want to make the right choices, who want to be a part of the community and need the opportunity to do so, we're able to make better connections with companies to better understand this. This also serves a really important business need, which is another reason this is incredibly simple, is companies want dependable folks that are going to come to work on time, that are going to cross-train, that want to be there, that need the job as much as the company needs them. And this is an opportunity to be a part of individuals' success stories, which creates and contributes to family stability, community shared safety, and thriving workplaces. We talk a lot about the importance of diversity and equity and inclusion in the workplace, and those often become buzzwords. And something that gets missed in this conversation is that including people with different experiences in life, so diversity of thought, diversity of experience, adds to these thriving workplaces and shouldn't be considered a number or a quotient that they're meeting, but rather creating the best, most inclusive, culturally relevant workplaces we can. The good news is that once we've challenged individuals' beliefs and perceptions around this work, the actual professional application to this work is really simple. You can do all of this with a traditional employment strategy. The nuances that are specific to second chance employment and including people with conviction histories will actually serve all employees. It's not about singling out a group. It's about recruiting intentionally and making this a part of your talent acquisition strategy so that your entire workforce and your company continues to thrive. There are not a lot of things that are needed from a company to get started and do this quickly. However, there are some policy things that can be considered that can continue to help make this possible. So work around ban the box, both at private and public levels and at the federal level, can continue to be pushed. A key piece that needs to be considered is occupational licensing. There are hundreds and thousands of people that have conviction histories that have the training and capacity and ability to do incredible things, but occupational licensing sits as a barrier to this to access to those jobs. And the third one that is incredibly important is reforming work around fines and fees so that people are able to get their driver's license, be able to have reliable transportation to and from work, and just be a part of their community and their families in a meaningful way.
Thank you, Genevieve. I have a number of questions after just hearing from the panel on response to just the opening question regarding their work and their connection to shared safety. Front of mind is Susan, is the work you're doing in California. And I mean, right now, we are in the midst of a COVID outbreak in the state. There have been conversations regarding people being released. Support for them has come up in discussions, but I haven't seen a consistent discussion regarding where resources are going to go and how people are going to be supported when they are released. So can you please talk about both the what's going on in California and the challenges that reentry community is currently facing.
Yeah. So, COVID-19 has hit all of us really hard. But for the incarcerated community, they are really at such a high risk. No ability to social distance, no ability to get the level of medical care that's needed to confront an infected person and so forth. So our governor has is in process of releasing 8,000 people. He announced that he would be releasing 8,000 people. And there's no reentry infrastructure in California. And, and shame on us, because everybody, 95% of the people going into prisons and jails are coming out. And we should be prepared to bring them out in a safe way. So what we did at A New Way of Life was a small effort to expand our services, and we opened up another house. We'll be opening up another house. Actually, the St. Vincent de Paul Society gave us a convent, and we'll be opening that up in the middle of next month to provide housing for some of the releases. But, it's almost like the California and the rest of the country, when we talk about reentry, we're walking around almost with a broken leg, because we haven't invested in reentry in a meaningful way. We've invested in prisons. We've invested in punishment. We've invested in all of these other things that do not promote safety. And we have a solution here.
Yeah.
All of us has presented real proven solutions that have the ability to really make our communities safe. I was thinking about Oswald and thinking about, had I had victim services, and I lost and I was harmed so many times down my lifeline, and then to have to end up in prison because I'm medicating the grief of a child that I lost. And over and over again, I see this in the reentry homes. People coming with so much potential, so much wanting to be that good employee, wanting to be that good mom, wanting to be that good student, and we providing that type of support. Robert, I walk around the house. I lost my son. But I go over into the homes and I see these children that know what I'm doing made it possible for them to be there with their moms. And I see, they come and Miss Burton this, Miss Burton that, and grab, run and hug me and stuff. This is what we can be doing all over our nation. We see that mass incarceration has sent us into such a deficit nationally, and that it's not creating the world that we want to see or live in. So I'm going to end on that because I'm tearing up a little bit, thinking about those little babies and thinking about if I would have had some place to go to learn about grief. To learn about, how to heal from so much abuse, lifetime of abuse. So I'm proud to be walking this road with you all to as a part of this national coalition for shared safety to bring about a better community, a better nation.
Thank you so much, Susan, for that and for sharing with everyone about your loss. this is why we all do the work, right? Is to make sure that families stay connected. Oswald, I would love to bring you in and Dr. Benjamin into this conversation. What is the responsibility of government in addressing needs like what Susan shared, and how can government, or what are the mechanisms or levers we can pull on from government to ensure that resources and support get to people on the ground that's providing this important and critical work?
Well, let me speak from time as both a health commissioner in Washington, D.C., and the time I spent in Maryland as a state health secretary. And in those days, I felt my job was to help enable people to have a healthy life. And in doing so, that meant that I had to make sure the services that we did fund and we worked were efficient, that they didn't, by their very nature, help people fall through the cracks, so that we had seamless services, that we treated people with dignity and respect. But I tell you, one of the most important things was letting them know that the services were there.
Yeah.
So far too often, we have an enormous amount of services. They're great ideas. Members of our city council when I was in DC, or my state legislature when I was in Maryland, and then average citizens had great ideas, and they would get those ideas put in the law, and then nobody knew about it. So that's the first thing, letting people know about it. And then I think clearly making sure that they get implemented, and that when there are problems, because look, you can't have a large program without problems, that you fix those problems, you identify them. I often say bad news doesn't get better with time. So having someone that will tell you when things are going wrong and trying to fix them. And then also not looking at them through silos, so that we understand that people are a continuum from prior to the time they're born to the time that they pass, and their whole life. We need to make sure that we are providing services for them, because if we simply think of them as an individual that has a problem while we have them, and not understand how that problem developed, or what happens once they get out from under our umbrella and our program, then I think we're missing the mark.
Yeah, and I just want to add that we must listen to crime victims of what crime victims want. And, what we need is real investments. Investments, we need being able to help, put in federal budgets, put in state budgets, resources for those community-based organizations that are often the first responders in communities. I'm talking about the mothers who've lost children to violence that have now, ran their own organization that are all volunteer-based. I'm talking about the intervention organizations who are on the front lines to violence, providing street outreach, but don't have the resources that they need to hire more staff and to reach more victims. And so there just needs to be an investment. And we know in communities from across the country, in communities of color, we haven't been invested as it relates to victim services. We haven't been invested as it relates to trauma recovery services. And if we're able to invest in communities, and it starts with budgets, let's put money in federal budgets, let's put money in state budgets to really address trauma. We know that many victims of violence are often need the support and services that they need. I always think about the young man that shot me. What if when he was 14 years old and he had access to victim services, being able to get counseling, therapy, physical therapy, maybe I wouldn't have never got shot. Maybe I would be overseas playing basketball today, but because we didn't have those investments in our federal, in our state budgets, that the cycle of violence continues, and we must change that.
Oswald brings a very important point, is the fact that we always have these red flags. So I ran the ambulatory care center at the City Hospital in Washington, D.C. And we had a big, busy emergency department. We were the biggest center for violence, trauma care, gunshot wounds, knife wounds, all that kind of stuff. And you know, we would have somebody come in who'd been in a fight, fist fight. And we knew that a few days later, they're going to come in with a knife wound or a gunshot wound, or somebody that they went to get would have that knife wound or gunshot wound. And we really tried early on to do some early intervention in those folks. But I got to tell you, we couldn't get those programs funded. They just wouldn't put the money there. For some reason, it was okay to spend all the money to incarcerate those individuals, but not 1/10 the cost to do the early intervention. So it's cheaper to treat them earlier.
Absolutely. And Dr. Benjamin, this makes me want to bring in Fernando into this conversation. Fernando is literally, work for the last several decades have been taking the knife out of kids' hands before they even get into situations where someone ends up in the hospital. Fernando, what's your reaction to the conversation you're hearing right now?
No, it's a great conversation. It's needed. I think it comes down to, I think Aswad spoke to it as well as Susan, is the need to build an infrastructure, right? And so at the ground level, if you have young people that are perpetuating violence, how do you engage them before they pick up that knife or provide alternatives to actually using the knife or using the gun? Having people that have what we call the license to operate, that are credible messengers that can engage those young people and provide an alternative to violence is key. The only other people that sometimes are dealing with the gang-involved community are law enforcement, right? But they're dealing with them in a different way. And so having peacemakers out there that can mediate, de-escalate tensions at the ground level is key. But there needs to be an infrastructure for that. Men and women who are coming out of prison many times are recruited to be peacemakers because they want to. They've changed their lives. They've worked hard to transform their lives, and they want. Many times they want to atone for some of the things they've done in their past. And what we've demonstrated across the country and cities across the country is that it's not once a gang member, always a gang member. It's not, once you're released that you're stigmatized a bad person forever. You can transform your life and actually create safety, stabilize communities, address trauma, and start to engage the next generation to save lives. And going back to infrastructure, when we're looking at federal dollars going to cities is a good thing, specifically on non-traditional public safety strategies. But also not only just to cities, but at least 50% of those budgets should go to building community infrastructure and community capacity to have street outreach workers, to have mental health first responders, to have people that are health promoters, particularly during a pandemic, having people that can navigate the community and engage the hardest hit communities. And so that infrastructure takes a long time to build. It takes sustained dollars. It's not going to happen in 2 years. But when we're talking about taking it to scale, we have to scale the resources, but systematically build an infrastructure that is coordinated between the multiple municipalities, between county, city, as well as the community-based organizations to create a parallel structure that ensures safety and public health.
And Fernando, I have a follow-up question for you. I want to bring Janvia into this as well. People often get confused when you use the term public safety, right? And the reason why they get confused is when you hear public safety, you think of law enforcement, right? But that's not what we're talking about today, right? I have a friend, Akila Sherrills, who said we need to put the public back in public safety. And so, Fernando, can you speak on that piece of it? And then Janvia would love to hear you, also speak to kind of the broader notions of safety and the public.
Well, thank you, Robert. And I mean, you're absolutely right. It's really broadening the frame of what we mean by public safety. And traditionally, when I say non-traditional approaches, traditionally it's always been law enforcement's role to address all forms of public safety, right? And that's been the paradigm that has existed since the tough on crime era. And when you talk to law enforcement now, some will say, look, let us deal with serious crime and develop other levels of professional practitioners who can address mental health issues, intimate partner violence, that can address, take the gun, get the gun away from the kid before he uses it, right? And that is a different mindset. I think we're expanding the frame of public safety to include the public, as Akila would say, but also look at it from a health perspective. So when you link public health, and we see the gaps in public health during this pandemic, we also see the gaps in public safety with the recent uprisings. We have this unique opportunity and ability that people have been working for generations to start to redefine public safety and broaden it out. So it's not just all on law enforcement. That community has agency and has the responsibility to ensure their kids in their community, their neighbors, the people who serve their community can be safe, and they have agency in that. We can't give up our agency in creating public safety and just rely on law enforcement to do so.
Thank you, Fernando. Javia.
Whew, that's hard to follow, Fernando. I think one of the things I think is important that we all think about is that in this particular field, if you're not already related to criminal justice or public safety or community safety, this is a largely unknown field for you. So if we're just thinking at just a citizen level, what do I know about my community? What do I want it to look like and sound like and feel like? It is our job to become equipped and informed. We can't solely rely on hoping that others have our best interests at heart and that they're operating the way that we would hope. And so I think the first bit that I just want to hopefully encourage people to think about is what's happening in your community now? What are you happy with? What are you not happy with? What do you just not understand? Because public safety isn't a thing that we learn about when we are going through elementary school and high school. This isn't a thing that you know about when you go through college unless you pursue it specifically. This isn't something that's common knowledge. So if you want to see change, we need to be a part of that change and not rely on others and optimistically hope that they have our best interests at heart. So becoming informed around what's happening in our communities, what we can do as just the general public is vitally important. 6 years ago, criminal justice reform was not broadly understood. It wasn't something you could have a dinner table conversation with somebody who wasn't in this field and have them have any understanding of what that is. We're in a moment where people across the country understand that mass incarceration is real, that it is a threat to our communities, and that there has to be something done. And there is general agreement that it's not okay to continue the way that it has. We need to see the same thing for this idea of shared safety and what that means, and be less concerned about what do I get out of it, and does the person next to me have what they need to be successful and to either have the same success that I have or to move ahead. And so that is definitely like my call to action for the day is think about what we as individuals have and the agency we have to affect change and become equipped to do more.
Thank you, Javia. Now I would like to go to audience questions. Thank you all for listening in. Really appreciate the time and attention you have paid in terms of listening to our panel. Have a question from Joseph. The SBA's PPP program excludes business owners with prior records from assessing loans when they needed it the most. Do you support reforming those programs so people who served can access them? Susan, Genevieve would love for you to talk. I think we have a partnership right along these lines that you might want to speak on. And then, Susan.
So 100%. This should absolutely be applicable to all companies that needed this assistance as it came out. Because of I'm going to call it a speed bump in this not existing in the first round, we actually had a partnership with Alliance for Safety and Justice and Unite LA and Dave's Killer Bread Foundation to help start filling a little bit of this gap. We saw that there are people with criminal convictions that often one of their only options for employment is to become an entrepreneur, to get innovative and creative very quickly so that they are employed and can be a part of the community on the right side of the law. By not allowing access and opportunity to the same resources that everyone else gets, we then continue to put a group that should not have to be grouped out into a separate bucket with less ability. So yes, 100% support the idea that this must be reformed. There needs to be equal access to it so that all companies have the opportunity to thrive and survive post-COVID.
Yeah. Susan, you're on mute.
I want to say yes to that also. And that's one of thousands and thousands and thousands and thousands and thousands and thousands of barriers that people face as a result of a criminal conviction. You know, we say time done, but time is never done in this country. You know, I've done everything I can to prove my, I want to say, outstanding citizenship. But just last year, I was denied a global entry application. So we have to, you know, this coalition for shared safety is a start to look at what we all need to do to have that shared safety. But the collateral consequences that people walk around facing every day, we need to not only take it from the PPP loan, we need to end punishment after incarceration. And I want to say we need to question punishment as a tool for crime across the board and look at rehabilitation and look at healing. So I can go on, but I'm gonna stop there. But we say time done.
Time done.
Time done.
Time done. Let's do it. Absolutely. Thank you, Susan. Let's have one more question from the audience before we wrap this up. Christina, are we going to get a question or should I ask?
You can ask one. We're still waiting for them to populate.
Okay. All right. We have 8 minutes left, so we won't have time for many more questions. But my question, as I look at all of you and how your work intersects around shared safety, and how you each have been doing your work, for decades, but now are coming together in this new formation. Like, what does shared safety mean to you? Not from the work part, but from the gut. Like, what does shared safety mean to you?
Hi, this is Georges Benjamin. As a citizen, shared safety means shared. It means that I have a responsibility to, obviously for my own safety, but that, thinking from a public health perspective, means that I have to think about a broader perspective on safety than just me personally. That means I have to have a safe community. That means I have to do the things as part of my citizenship to engage, talk to my elected officials, demand that they fund the right programs. Don't just blame individuals. Ask how did this problem develop? How did this person, frankly, get in trouble? Could it have been prevented? And what can I, as a citizen, do to aid in supporting my elected officials to make sure they do the right thing?
When I think about shared safety, I think a lot about how this work is not binary. It's not simply black and white, right and wrong. There's a lot of gray area. So applying that personally as being a mom of 2 sons, it's important to me that I'm making sure that I am teaching and equipping them to see this differently. The lessons we didn't get in school or from the people in our lives that were tasked with caring for us, it's our job to make sure that we are raising the next generation to not accept the status quo just because that's the way that it's been, and rather equip them with action steps so that we have people of action that are going to make the world that we all want to see and live and work and be a part of.
I think a prerequisite for safety is freedom from violence, but it goes beyond that. I think shared safety is broader in the sense that it also means having a safe place to live. It also means having access to food. It also means not only just being able to walk down the street and feel safe, but also not be exposed to toxic stress. To be able to thrive in your community is one of the, I think, key pieces to make sure people feel safe. If there is no safety, if there is no freedom from violence, if it's not shared, it's on the shoulders of everybody. It's the responsibility of everybody at multiple levels. That is where we're going to start to allow communities to thrive in ways that we haven't seen. And when I think of shared safety and why Urban Peace Institute is part of this coalition, is because we want to help shift the paradigm to move our understanding of safety based on the voices of people that have experienced the lack of safety in many ways.
You know, I think of strong families. I think of good schools. I think of opportunities. You know, I think of accountability, institutional accountability, but personal accountability too for our folks. I think of responsibility and autonomy to make your decisions and just be a part of a thriving community. But what I know is that we must have strong families to have strong communities and safe communities.
And when I think of shared safety is, listening to us as survivors. We've been excluded from these conversations for decades, and, being part of this coalition to represent the voices of victims across the country, we know that when people got access to jobs, that's increasing our safety in communities. So shared safety to me is all of us working together to address the root causes of violence and trauma in our communities.
Thank you all. When I think of shared safety, when I close my eyes and thinking when I'm most safe, is when people are fighting and advocating for my safety. I think about y'all. I think about the folks that are in this coalition, and I'm in deep gratitude and appreciation for you to come together to make this happen, not just for your communities, but for my sons, for our families, for our loved ones. With that, I want to turn it back over to Lenore Anderson, who's going to close us out.
Thank you, Robert. I just want to echo what you just noted, which is the heroic leadership of the people we got a chance to talk to today. Thank you, Dr. Benjamin, Fernando, Susan, Janvier, Aswad. What you all are doing is what it's going to take to transform the nation's approach to public safety, and we're greatly honored to do that with you. This country's in an unprecedented moment, one in which we have near consensus on the urgent need for criminal justice reform. It's a system that we now understand spreads poor health, and it's unfair. So the opportunity for decision makers at the federal level is now what? What are we going to do instead? What we've learned from advancing criminal justice reform in states across the country for the last 8 years is that the solutions are hiding in plain view. The solutions are right there in front of us. You heard from the leaders who are every day working to transform communities and advance safety, improve health. And those solutions need to come from the background to the center. And this is something that broad consensus can be built around. Broad consensus can be built around investments in public health solutions to mental health crises and substance abuse crises, violence prevention, putting peacemakers on every corner, reentry, giving people dignified opportunities for meaningful rehabilitation, and survivors at the center, ensuring that those who have been left out for too long become the voice that guides us towards safer communities. So with that, we say thank you so much for joining us today. We look forward to growing this coalition, to partnering with many of you who are listening in to transform our federal investments, our incentives, our policies, and what safety looks like in all of our communities. Thank you.